Hello, everyone. Welcome to Global IMMUNOTALK 2024. I'm Kazuyo Moro from Osaka University. So before moving to today's talk, I have a housekeeping announcement. In this Global IMMUNOTALK, unfortunately, we cannot take the direct question. So if you want to make a question to the speaker, please go through the Twitter. I'm going to announce how to make a question after today's talk. So now I would like to introduce today's speaker. Today we'll welcome John Silke. So let me give you a short introduction about him. So John, born in UK and finished PhD at University of Zurich in Switzerland. And afterward, he moved to Melbourne, Australia, where he made significant contribution to the field of cell death. And he is currently serving as a professor at the Walter and Eliza Hall Institute in Australia. So his outstanding research on TNF superfamily and ubiquitin E3 ligase and RIP kinases has led to the understanding of the cell death and also inflammation. So now I would like to call John. Could you, John, please turn on your camera? Hey, hello. So thank you very much. Hi, thank you very much for joining this program. We were so excited to listen to your talk. Okay, so before moving to your talk, we always make one question to the speaker to know the personality. So may I? Okay.
Of course,
so,
yeah.
Today's question for you is that could you share one of the most impactful decision in your career shift is the question.
Okay, I'm going to cheat. I'm going to give two answers, I think, because and the first one was actually I started and did a law degree. So I finished that law degree when I was 21 and realized that this was not the career for me. And I think that's particularly relevant. I have my 3 sons and they're all around this age and they're all wondering what they're going to do. I think it's pretty normal. And it was very worrying time of life where you think, I don't know what I'm doing. And I made the decision that I wanted to go back to doing science, which I'd always loved as in school and as even as before school. And it took a bit of bravery, but I took that decision and then went to do my biochemistry degree in Cambridge University. That was absolutely impactful to this career. And secondly was really this choice to come to Australia. And it was really driven by listening to a talk in a seminar while I was doing my PhD in Switzerland and hearing about the great work that was being done at the Walter and Eliza Hall Institute and by 2 particularly great scientists here. And I sort of took the chance and came here and haven't been able to escape since. So sometimes, you know, decisions take a lot of thinking about and a lot of angst and a lot of worry. And then sometimes you just make a decision and see how it goes. I really had intended to just come for a postdoc for a couple of years with my wife and our first young son. But you know, that simple decision then led to you know, me being here now for 27, 28 years. And I hope that sort of gives a flavor of my personality.
Wow, it's first time to welcome like someone graduated from the law field. Okay.
Yeah, I've got to now prosecute my case. Yes.
Wow, fantastic. Okay, so if you are ready, could you please share your slide and start your presentation?
So my title is simple, cell death and inflammation, but it hides a bit of complexity. is will no doubt demonstrate. And also a little bit of controversy, because there's still such a lot of discussion about the exact role that cell death plays in the inflammatory response. And I hope to be able to give my own particular viewpoint on that today. One thing that there isn't any controversy about is that TNF is a driver of chronic inflammatory diseases. So you can see here a psoriatic patient and the miraculous response from TNF inhibition. And while this is a psoriatic patient, many inflammatory diseases could be similarly efficaciously treated by blocking TNF. I had a friend who has ankylosing spondylitis and went on the TNF inhibitors, and he said within 24 hours he felt like a new person. Very, very potent cytokine. But I think we still don't know how TNF inhibition is able to produce such profound effects. And this is a really important question, because the TNF inhibitors are extremely expensive. Not all patients respond, and not all diseases are so amenable to TNF inhibition. So really understanding how these TNF inhibitors work to produce these effects could really make a big difference. So the classical view of TNF signaling is that all of this inflammation is driven by a transcriptional response. So when TNF, the ligand binds to its receptor, TNFR1, the signaling complex forms. This is driven on by assembled around a ubiquitin platform. And the ubiquitin is assembled, the ubiquitin chains are assembled by the IAPs, ring containing IAPs, and the linear ubiquitin assembly complex, LUBAC. And that's composed of 3 components, and particularly sharpen is relevant for a lot of this talk. So that leads to activation of NF-kappa B and MAP kinase signaling pathways. And that transcriptional response leads to production of cytokines, prostaglandins, nitrogen oxide, and of course, this also the factors that result in immune cell recruitment and activation. Producing the classic phenotypes of heat, pain, redness, and swelling that have been recognized for now 2,000 years. So that's the classical view, that the transcriptional response is critical for the antipathogen inflammatory response and in driving pathology in chronic inflammatory diseases. And certainly pathogens have taken that lesson on board. They know that it's important because, and again, you're not expected to see all the details here or remember all the details, but these black boxes here are pathogen effector molecules that are designed to inhibit that TNF signaling response. Now, evolution doesn't stand still. If the pathogen has a way of getting around this response, then the host responds by inducing an apoptotic response, a caspase 8, caspase 3 driven apoptotic response. So that's when this pathway, the transcriptional response, gets inhibited. Again, some pathogens try and inhibit that apoptotic response, and that can result in the activation of a necroptotic cell death, where MLKL permeabilizes the plasma membrane, leading to the leakage of cellular contents. And I think if we think in just in these terms, that it's entirely plausible that TNF-induced cell death could be more inflammatory than the transcriptional response, because it's really indicating a level of danger, a level of threat that just the transcriptional response doesn't communicate. We have pathogens that are trying to interfere, professional pathogens, if we like, trying to interfere with this inflammatory response. And the reason that we started to rethink about how TNF drives inflammation was studies with this mouse, now a long time ago, where we showed that the sharpen mutant mice, remember that component of LUBAC, is defective in that transcriptional response. but it suffers from this autoinflammatory disease. So these mice are born normal for 3 to 4 weeks. You can't really see any overt signs of inflammation, but as they get a little bit older, they start to show signs of inflammation until about 11 weeks, 11 to 12 weeks. We have to sacrifice the mice because they're suffering from these horrible sores. This is also, you can see this can also be seen in the keratinocyte hyperplasia in the skin. There's clearly a lot of proliferation going on in the skin. There's also periportal inflammation in the liver, the infiltration of immune cells, and splenomegaly. And to our surprise at that time, simply crossing these mice to TNF knockout mice, and in this case, this is a heterozygote TNF knockout mouse, really blocking the emergence of this inflammatory phenotype. And, you know, as you might imagine, heterozygote, not dissimilar to the sort of dramatic effects TNF inhibitors have on a disease. And it's now been shown, and one of the attractions of this mouse has really been very well analyzed now, is that TNF-induced caspase-8 dependent apoptosis is really driving the skin inflammation. So you can see here, this is a normal keratinocyte layer. In the sharpen mutant mice, you get this hyperproliferation. Again, if we look at the keratin 14 stain, it looks very beautiful. And you can see that crossing those mice to a caspase-8 mouse, and even just having only one copy of the caspase-8 gene is sufficient to really get rid of that inflammatory phenotype. And what you can also see here is this marker of apoptotic cells, cleave caspase-3. And you can see that this keratinocyte layer is just full of apoptotic cells. Now, in a normal healthy tissue, a lot of apoptotic cells are, there is a lot of apoptosis occurring, but very difficult to detect because they are really taken up very quickly. And so almost impossible to detect. So when you see this large amount of apoptosis, we think it actually indicates even much higher level of apoptosis because some of those dead cells are being cleared up, but not all. And again, you can see that getting rid of caspase-8, as you would expect, really blocks the formation of apoptotic cells. And Manolis Pastorakis' group has shown that it's really the death of the keratinocytes that is driving this phenotype. So in an epidermal knockout of TNFR1, you really get rid of that inflammatory skin phenotype. Excuse me. For those of you not too interested in mouse skin diseases, there is a collaborator, Hiroda, has identified HOIP mutant patients that also suffer from a dermatitis. And I think one thing that's interesting here in the context of thinking about the sharpen mutant mouse is that the HOIP, loss of HOIP in these patients is sufficient to result in the loss of all of the LUMAC components. And somehow they're regulating each other, probably post-translationally. One thing that is absolutely critical to the interpretation of this mouse, and what I'm going to talk about, is that the dermatitis is not driven by the microbiota. So when Holly, and most of the work that I'm talking today is driven by Holly, a great postdoc in the lab, been with me for several years, shows that when we put these mice in an abiotic environment, that it has no impact on the phenotype at all. The severity, the onset is all the same in these germ-free mice. So it's nothing to do with the commensal bacteria. We don't have that complication in this system. And I think that that's particularly important and helpful when thinking about this model. So our hypotheses are that evolution is worked at such that there is really a perfect amount of information that will repair a damaged tissue and negate a threat. It's clear that if there's too much inflammation, this can be damaging, and so the system has to be really exquisitely wired so that it just generates the right amount of inflammation. Normally, that right amount of inflammation will be that driven by the transcriptional response. We'll get a certain level of cytokines and cell survival and recruitment of immune cells, but that will be all that's needed. However, if there is an emergency or threat situation where that transcriptional response is interfered with, then the cell can respond with an apoptotic response, but that is going to indicate a certain amount of danger. It is still the preferred type of cell death because by its nature, by the way that it's cleared up, it's less likely to incapacitate a tissue. And that's going to be particularly important when you have cells dying in barriers. You don't want to really compromise the efficacy of that barrier. It reduces the release of cellular contents, and we think that the cellular contents are really the thing that is then indicating a level of danger and easy to clean up after. And because those apoptotic cells are really packaged, all the contents packaged, professional cells there to clean them up. And we think that this is particularly important because it's preventing the possibility of generating an autoimmune response. So when you start to get release of cellular contents in an inflammatory environment where there are pathogen-associated molecules, PAMPs, this could lead to breaking of immune tolerance because you're creating a dangerous situation with cellular contents, whereas in an apoptotic cell, you don't have that. You're getting rid of those that particular danger. Nevertheless, in some situations, it's clear that evolution has come up with this alternative response where MLKL permealizes the plasma membrane, leading to the release of cellular contents and necroptosis. And we think this is then indicating a very heightened level of danger. And maybe, as I'm going to show you towards the end of my talk, that in some situations, that inducing that necroptotic response could really be too much inflammation, seems to be impairing the sort of healing repair response of the inflammation response. But nevertheless, from an evolutionary perspective, it may, in certain bacterial infection scenarios, it may be advantageous to overreact because the tissue may not have a lot of time to react and therefore should come in hard as soon as possible. And I like to think of necroptosis in this sort of Australian term called spitting the dummy. You use it about children that just can't take it anymore, and it's pretty clear what it means. But of course, if you apply it to an adult, it's really talking about an overreaction scenario. And I'm, talking a lot about necroptosis because there's a lot of interest in this particular pathway. But I like to inject a little bit of reality and push back to my colleagues about the importance of necroptosis. Because, and I'm sure you've seen the title here and answered this question for yourselves already, but of course the answer is that there's only one of these animals that has the necroptotic pathway, and carnivores have lost MLKL. And that this really indicates that necroptosis is not required to be a beautiful animal. There are other clades of animals that have lost RIP3, but RIP3 that activates MLKL also performs a number of other functions. So I don't think that's so clear, but at least in these animals, they do not have MLKL, and therefore they can live perfectly normal lives without it. And many people have put forward explanations of why this particular group have lost it, lost the necroptotic pathway. I have a sense that these are often just so explanations after Rudyard Kipling's fables, explaining that how the elephant got his trunk and those sort of things. But the take home here from this particular slide is really that you can be a beautiful functioning animal and you do not need the necroptotic pathway. So, and I don't want to labor this point too much, but I think it's really important because, as I said, there's still disagreement and controversy in this area. The key thing is that cell death doesn't occur in a vacuum. It communicates information to the tissue, but there is the context in which it occurs, which is also important. So you can have the planned embryonic development type cell death, or the homeostatic cell death, getting rid of old cells, sculpting tissues. And then you have and it's clear that in those situations, you don't want an inflammatory response. That's just normal. And you want to get rid of those without any sign of any inflammation. But then you're going to have other situations that are unplanned, and that there the cell death is going to be protective. It could, or just because of a loss of blood supply or whatever it is. And in those situations, they're going to be quite complicated situations, and then the tissue needs to gauge the strength of this inflammatory response and assess the level of danger. And we think that location is going to be one of those important components of that response, because if it's occurring in a sterile environment, that's not going to be as dangerous as cell death occurring in a non-sterile environment, where you're going to get exposure of previously sterile tissues to potential pathogens, and that can be, you know, whether it's sterile or non-sterile, indicated by the presence of PAMPs, pathogen-associated molecular patterns. I think that one of the key factors that is going to influence this sort of inflammatory response is the amount of cell death. Is it a small amount of cell death or a large amount of cell death? A large amount of cell death could really be indicative of a viral infection, for example. And one of the ways that this could impact on the tissue is that it's going to release a lot of dead cells into the environment that can't all be cleared by the professional cells. And then there's going to be the type of death that we think is also possibly indicating a particularly dangerous scenario. But one thing that is that really needs to be considered is that whether it's this homeostatic death or emergency death, it's going to necessitate cell replacement. And when you think about already the sharpen mutant mice that I've shown you, it's clear that there is this keratinocyte hyperplasia, that those cells are responding more, there's more cell growth than there should be in this inflammatory response. It's not just dying cells, there's a lot more healthy keratinocytes too. So again, not to labor the point, but non-inflammatory cell death, normal cell death, there's going to be no release of DAMPs. This is our idea, and there's nothing, the detector cell just goes, this is a normal situation. Whereas in inflammatory cell death, there's the context of whether there's release of DAMPs from dying cells, which shouldn't normally happen, whether there are PAMPs from pathogens that should normally be there, that these are then detected. This leads to TNF. And in the case of the sharpen mutant mouse, really seems to lead to this vicious cycle, and also would think to potentially in those chronic inflammatory diseases. And so our hypothesis here is really that the presence of dead cells in a tissue indicates that the garbage system has been overwhelmed. And you've already had a seminar from Ravi, excellent seminar about the importance of this in this program. And this is the unpleasant odor. We've got dying cells here, and it's sending a message to the tissue that there is a lot of cell death, more than can be coped with by the garbage collector. And again, when you, as I said, in a normal healthy tissue, it's almost impossible to detect dying cells. And so when you actually see them here, this actually indicates that the amount of cell death is much more than you're actually seeing, because some of them, at least, are being rapidly cleaned up. So to test this hypothesis, we took advantage of the NINJ1 knockout mice. Now, NINJ1 was identified by Vishva Dixit's lab a few years ago now, and it's a transmembrane protein, and it seems to be particularly important in not in the early stages of apoptosis, but in the later stages of apoptosis, which normally you can't detect in a tissue, for the release of the cellular contents. And you can see that here in the nice assay from their paper, where they're getting release of LDH, and you can see whether the apoptotic stimulus is cytotoxic or a TNF superfamily member like and that you're getting reduced release of cellular contents in the NINJ1 knockout cells. It's not really been tested in animals, so this is unpublished data, and we can see that in the sharpen mutant mice, it's before you see this dermatitis, but when we cross them to the NINJ1 knockout mice, we're really getting a very obvious protection from that dermatitis phenotype. We don't get complete protection. It's not like a loss of TNF or as I'm going to show you, loss of the detector cell. We're getting a delay both in the homozygote and the heterozygote NINJ1 knockouts. Now, we think that this is entirely consistent with our hypothesis. What we're doing is preventing the release of, we're slowing down the release of DAMPs. But in the sharpen mutant mouse, you've got this constant induction of cell death. And at one point, we're going to get the overwhelming of the response, and we're therefore going to start to get the release of DAMPs. One thing that's really nice about this is that with the sharpen mutant mouse, we know that some of the systemic inflammatory phenotypes are not driven by apoptosis and therefore wouldn't be dependent on NINJ1, but they're actually driven by necroptosis. And you can see here that when we get rid of MLKL, for example, we don't get the periportal inflammation and we don't get the splenomegaly. But in the NINJ1 knockouts or the heterozygotes, we're still getting the splenomegaly. So again, consistent with our hypothesis that it's the release of contents from dying apoptotic cells that is driving the inflammation in the skin. And we do see effects on just general health and body weight by getting rid of NINJ1. So the idea here is that the levels of apoptosis in the sharpen mutant mice don't disrupt the barrier. What's happening, we think, in these mice, remembering that it takes a few weeks for the phenotype to really get going, is that in the skin, there's just stochastic apoptosis, TNF-driven apoptosis. This creates dying cells, and particularly in the sharpen mutant, because they're more sensitive to TNF-induced death. As those dying cells fail to be effectively cleared up, they start to release DAMPs. And therefore, in the absence of NINJ1, what we're doing is slowing the release of these damage-associated molecular patterns. We're slowing the the tissue really responding and saying, well, we've got an awful lot of cell death here, too many dead cells that we can't cope with and that we need to replace. So it looks it's very clear that in this model, cell death is driving the inflammatory TNF response. But one of the questions we wanted to ask is whether there's a particular cell type producing the TNF. And to cut a long story short, this is published, but I think it's one of those papers that you might overlook, be less interested in, and yet it's a piece of work that I'm extremely proud of. We made a number of diphtheria toxin receptor knockouts of different cell types, dendritic cells, monocytes, macrophages, had no to very little effect on the sharpen phenotype. And we were just lucky in a way that we had the Langerhans DTR mice knocking around, and so could test those in the same batch. And what you can see here is that in the Langerhans DTR mice, where we deplete Langerhans cells, and you can see that nicely indicated here in this plank panel, and quantified over here. When we deplete those Langerhans cells, we are really interfering with the emergence of that dermatitis phenotype. So what do we know about Langerhans cells? Not me, not very much. Of course, they're named after Paul Langerhans, and they have these very clear dendrites that are interdigitating in the skin. They've come a long way from some early opinions that they're just immature dendritic cells that live in the epidermis. They really comprise about 3% of cells in the epidermis. They're really there in abundance. And what they rather seem to be is some kind of hybrid cell type that is quite macrophage-like. It's there to eat up and clear things out, but also a dendritic cell-like presenting antigens. I think that that's entirely consistent with the way that we think about this problem for the tissue. You can see that they're beautifully laid out in this epidermal air sheet work from Holly. And with these dendrites, and these dendrites are not just static, they've been shown to, in this clever little acronym, search. So they have their dendrites extend and retract, and really in there sensing their environment. And this DC-like role has really been emphasized recently. A lot of people think that that's their key role, that they're there to present antigens, that they're key activators of Tregs. So they're really important for making sure Tregs are functioning and inhibiting responses, but also to activate effector memory T cells. Now, the key thing here in the sharpen model is that they don't play a role in T cells, don't play a role in the sharpen phenotype. So we're not looking again at some sort of complicated scenario here. This is not a T cell driven phenotype. And, as I said, I'm no expert on Langerhans cells, but I really like this review. And, they pointed out that while this is, a dominant model here of what Langerhans cells do in the skin, there are few scenarios, if any, in which removal of Langerhans cells ablate immunity to infection or results in the development of severe autoimmunity in the mice. And again, we depleted Langerhans cells and we did not see really any dramatic phenotypes in these mice except for preventing inflammation. So I think this view is, again, far too simplistic for what the important roles of Langerhans cells. And as I said, you can see we saw very dramatic inhibition of the phenotype by getting rid of Langerhans cells. So you can see, again, if we just focus on the keratinocyte hyperplasia in the sharpen mutant mice, you can see that throughout here. And you can see that in the Langerhans DTR Langerhans cell depleted mice, that we really revert that phenotype to the wild type, and we get rid of that apoptotic response and then all the other downstream consequences. If we're thinking about skin diseases, and we know that the sharpen mutant mice, we can treat it after the emergence and see how effective that would be. And this is what Holly did. If she treats these mice at about 7 to 8 weeks, when they've really started to where the phenotype is already remarkable, just by observation, gross observation. I'm pointing to my eyes because they start to get clear signs of dermatitis around their eyes and their ears. That's where it comes first. And so we can start to treat these mice when they're already having overt signs of inflammation with the diphtheria toxin, get rid of the Langerhans cells, and really completely delay the onset of the phenotype. Interestingly, and we don't understand this really at all, this also has effects on the sort of splenomegaly. You can see here in the spleen weight compared to the sharpen mutant mice that were inhibiting that, and also in the just general condition of the mice. So there's really a non-trivial effect on the systemic inflammation in those mice by getting rid of that skin inflammation. Now, we were particularly fortunate, I think, when we started to collaborate with Michael Chopin, and it was in Stephen Nutt's lab at the time, and he'd just developed this new strain of knockout mice. It's the SUS12, and it was driven off the CD11C locus. And so his intention was to get rid of dendritic cells. But in fact, what happened was that he didn't really affect dendritic cells at all, but actually got a loss of Langerhans cells. And again, you can see that nicely demonstrated here. Now, the advantage of this model is that we could prevent the disease. We could get rid of the Langerhans cells even before the disease starts to emerge. And what we could really see is a very nice protection, really profound protection against the sharpen phenotype. We did see occasional lesions that did then result in us having to sacrifice those mice. And I'll come to that in a second. And we also saw the loss of Langerhans cells, as before in the DTR mice, was really sufficient to really reduce the splenomegaly and the liver inflammation. As I said, we did get these sort of mice that did start to get lesions, and Holly was particularly interested in these. And what she observed is that, in actual fact, what was happening was that these Langerhans knockout mice, Langerhans cell knockout mice, were nevertheless, some of them were kind of escaping for some reason or other. And so she would get these little islands of Langerhans cells in the areas where she was getting the inflammatory response. So as I said, it's, for me, a beautiful internal control natural experiment where putting back Langerhans cells was sufficient in this sharpen mutant mice to drive the inflammation. And then, as the immunologist, you'll be very familiar with this type of experiment. But I've called it a tour de force because it really required some lateral thinking here from Holly. It's not possible to do a classical bone marrow transplant experiment because Langerhans cells are resistant to irradiation. So, and you can't replace them if they're kind of sat there in the skin. However, if you get rid of the Langerhans cells and that niche is empty, then it can be repopulated. So what Holly did was take the sharpen mutant Langerhans DTR mice, deplete the Langerhans cells with diphtheria toxin, then irradiate, and then repopulate with different bone marrows, and particularly, as I'm going to show you, TNF knockout bone marrow on a sharpen mutant background. And so, you know, this was, I don't know that this has ever been done before. We certainly couldn't find it. And so it's important to show that Holly was reconstituting Langerhans cells. So she did the Langerhans stain, and you can see we get a pretty good reconstitution of Langerhans cells into the skin. And again, it's a complicated experiment, so I'll walk through it slowly. So this is the positive control. We take Holly takes sharpen Langerhans cells and puts them into sharpen mice that have undergone this treatment, and sure enough, they get the chronic proliferative dermatitis. They get the disease. If we take those sharpen Langerhans cells with the diphtheria toxin receptor, and so we're putting those cells back in, but we're then depleting them with diphtheria toxin, then we get a very clear reduction in the disease. It's not complete, and we think that even though the diphtheria, we showed that the diphtheria toxin depletion is good in these animals, there's nevertheless the complication that the bone marrow transplant irradiation also creates a kind of inflammatory environment. So we think that could account for the fact that we're not getting as an absolute protection as we might have expected. Nevertheless, if we put sharpen Langerhans cells into wild-type mice, there's no evidence of disease. And again, this is exactly, we know that keratinocytes have to be undergoing the cell death to get the disease, and it's just the TNF from the Langerhans cells that is resulting in the phenotype. And the sort of obverse of that experiment, if Holly puts in wild-type Langerhans cells into the sharpen mutant mice, no disease. So again, it's saying that normal Langerhans cells into sharpen mutant mice, they're not over-responding, producing the TNF to the extent needed to get the disease. And this is, you know, particularly important result here when Holly takes the sharpen Langerhans cells that also have lost TNF, so TNF knockouts, then really getting a very profound protection from that disease. So it's really showing that it's TNF produced by Langerhans cells in the sharpen environment that is driving the disease. I should mention there, I think, again, it's kind of hidden on my slides by the Zoom bit, but oh no, that doesn't matter. Sorry. So in the last couple of slides, it's probably about five slides, 6 slides I've got left. I wanted to talk about another approach that we took to look at skin inflammation. Now, it's clear that genetic approaches are very powerful. They give very, very clear results, but they're extremely time consuming. They're very expensive. And we needed to find another way to look at skin inflammation, but still accessing the power of the sort of genetic approach. And what we did was take advantage of an observation that a finding that we had made many years ago, that using Smac mimetics to inhibit the IAPs, which, as you'll recall from my beginning slide, are really important in that transcriptional and cell death response, treating cells with Smac mimetic causes the destruction of the CIAPs. So you can see what happens is this, and we've shown this, is that the Smac mimetic promotes the dimerization and activation of the CIAP ring. This causes auto-ubiquitination and therefore degradation of the IAPs. And you can see it's extremely rapid. Now, this gel looks a little bit ropey, I would say. But that's because we lyse the cells in urea because we wanted to be absolutely sure that this was absolute degradation. There wasn't some hiding in some detergent insoluble compartment. And you can see it's extremely rapid. And you can also see, I think, pretty clearly that this is like having a biochemical knockout, and that's really what inspired the experiment. And again, this is published, so I won't go into great detail here, but we really validated that injection of Smac mimetic really mimicked the loss of IAPs and that it results in an apoptotic response in the keratinocyte layer. And you can see that very clearly here, particularly at the center point of the injection. We just get almost a complete ablation of that keratinocyte layer. Now, you can think of that as a very specific loss of IAPs that results in cell death of the skin layer. But I think you can also think of it as a kind of chemical burn that is actually killing off keratinocytes, and so relevant in that sense too. But the power of this approach now is that we can start to look again, sort of this hybrid genetic approach, where we can look at all the genetic knockouts that we have in the institute, in my lab, and we can start to ask, well, what happens when we induce this type of apoptotic cell death in this patch of skin? And what happens is that we get a very rapid cell death and a very rapid inflammatory response. So we get a very large lesion score by day 1. And then Holly can follow that lesion, and you know, you can see that it sort of gets its worst by about day 3, and as I'll show you, starts to improve by day 5. And we know that this is driven by TNFR1. You can see that the lesion score, and even at day 1, is completely lost in the TNFR1 knockout. Again, consistent with this sort of TNF and death, a RIP1 heterozygote also has a reduced apoptosis, reduced cell death response. And again, if we get rid of caspase 8 on a RIP3 knockout background, again, we completely get rid of that response. So again, another skin phenotype that is being driven by TNF-induced apoptosis. Now, this is an extremely rich data set. We're continually testing new knockouts, gasdermins and other knockout cells, other knockout mice, excuse me. But I just want to highlight one observation that Holly made, which has led to a very exciting collaboration, where Holly noticed that this had many features. This chemical burn model had many features of toxic epidermal necrolysis, and Holly is an encyclopedia of really obscure, strange, horrible skin diseases. And so she noted that Faz ligand mutant mice, the GLD mice, famous GLD mice, were not showing the same type of lesion, and also that interferon gamma was also in the knockout, was also reducing that kind of inflammatory response. And toxic epidermal necrolysis is a really devastating condition, in many cases lethal condition. it's usually drug-induced. It can be induced by a large number of drugs. It's extremely patient-dependent. Many of these drugs never cause any problem, but in a particular patient, they'll cause this massive die-off of the keratinocyte layer. And so the physician cannot know in advance whether a patient is going to undergo this horrible response. And this means that up till now, the primary treatments have simply involved get that patient as quickly as possible off the suspected medication and give them support for loss of the skin, hydration, and all those things. And this is obviously not a great situation, and as a result, toxic epidermal necrolysis has a very high mortality rate. And so we were fortunate that we had a connection with Matthias Mann's lab that does these amazing mass spectrometry experiments. And Thierry Nordman had done these beautiful single-cell spatial proteomics to identify the JAK-STAT pathway being activated in toxic necrolysis patients. And of course, I'm not going to spend a lot of time talking about his work here. It has just been accepted in principle in Nature, so hopefully you can read it yourself soon. But I wanted to show Holly's work here with the mouse model, where she started to test some of these JAK-STAT inhibitors, and you can see that when she used abrocitinib, she was able to get a really nice protection from that chemical burn model. And even in a sort of post, in a treatment model, so post emergence of symptoms. Now, this Smac mimetic chemical burn model is really very fast acting. We're already start to see extensive cell death and things happening at 3 hours post-treatment. So it really is, even though this is not the sort of time scale that toxic epidermal necrolysis patients would have, this is still a reasonable post-treatment model, and using the inhibitor baricitinib, able again to see a nice reduction in the extent of that of the damage. So really a great validation of this model that we've developed, and as I said, likely to be a source of much other more findings in the future. But now the last 3 or 4 slides, I want to discuss the role of necroptosis in this particular model. And as I pointed out, in the sharpen mutant mice, necroptosis is not important in the skin at all. And in this model, and again, as I've emphasized, it's driven in the initial lesion size is driven by an apoptotic response, and it is not driven by a necroptotic response. So it's not in the RIP3 knockouts, not in the MLKL knockouts. We still get the same lesion size as the wild type. But what Holly observes is that these lesions really heal much more rapidly. And you can see at day 3 that it's obvious in RIP3, not really obvious in the MLKL knockout. However, by day 5, it's really obvious that both the MLKL knockout and the RIP3 knockout are really have this accelerated healing. And that's really important point. The damage was the same at day 1, but by day 5, these mice have just healed much more rapidly. And so in this situation, it really looks like, as I said, that the skin is spat the dummy. There's been a necroptotic cell response that is over the top for what is needed in this situation. And therefore, the skin takes much longer to heal when it's wild type, and it heals much more quickly in the necroptotic knockout situation. And so what we're thinking is happening here, and what is different to the Smac mimetic model, is that we get this initial amount of cell death, and in contrast to the sharpen mutant model, where we don't get this disruption of the barrier, we're getting disruption of the barrier. So now, on top of this sort of TNF response, we're also adding into the mix that sort of commensal bacteria and you know, those other microbiota species that then indicate a level of danger and damage that is sufficient to cause a necroptotic response, and this then delays the healing. So the microbe entry is really, would seem, at least as far as we understand it at the moment, to be contributing to an induction of necroptosis. And if we can block that, we can dial down the level of inflammation and we can get quicker healing. So what I've tried to say today, about today, is really how TNF cell death inflammatory response very much depends on the context. Whether you get a breach of the barrier, you get exposure to pathogen-associated molecular patterns. It doesn't matter whether the commensal, the tissue, the skin cannot know whether it's commensal or not. It simply knows that this is a bacteria where a bacteria shouldn't be. It's also, it seems that one of the signals that the tissue is using to gauge the response is the amount of cell death. And really, you know, in this sharpen mutant mouse model, which is, you know, quite special, but special in interesting ways, we know that the inflammation is not T-cell driven, it's not microbiota driven, it's really being driven by the release of cellular contents from apoptotic cells. And that shows that in principle, this type of inflammation can happen. And of course, in the last part of the talk, sort of, again, while I think in evolution shows that necroptosis isn't really essential, there are some situations where, in fact, it seems to be deleterious if it gets activated, and it is somehow impeding the repair response in the tissue. So now I really just want to thank the people involved, and as I've said, the people that I want to thank have been acknowledged the most. Holly driving a lot of this work. We've had a lot of help from colleagues, including in dermatology and in the Peter Mac Institute. And I did mention work from our collaborators, Thierry, Norman, and Matthias Mann. And as I said, I only did that to show the sort of clinical relevance of this model, but also to advertise and to get you to look out from this work, from this spectacular work that they have done. So thank you very much.